Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. We have this gray cannula coming in the front. You're laying on your side, so your arm is actually pointing up in the air, and the socket part of your shoulder is at the bottom of the screen. If you were standing up and we were just looking from behind you, it would look like this with your left arm coming off to the side. There's the socket. We could look up and track the biceps tendon as it exits there. So because you're laying on your side, we orient it like this. And we can see some of the anatomy here. It's a little interesting. Your biceps really, let me see, shaver. Looks like it's blending into the rotator cuff here. We'll have a look at that. I don't really see a separate, distinct biceps yet. It's a little bit of fraying in the labrum here. As you look down the front of the shoulder, the anterior glenoid looks pretty good. Anterior labrum looks pretty good. We're concerned about what we saw with the rotator cuff here, some undersurface fraying, but that's really not bad. And again, the most interesting thing so far is your biceps anatomy here. We can see the middle glenohumeral ligament coming in, and it looks like a strong cord right there just to the left of the cannula. But we don't see, we see just maybe the edge of the biceps. Let's see if we pull back a little bit. There's not really a biceps we can get behind here. You see it's kind of encased in that sheath. And again, that's just a normal variant. Nothing to do. You can just see it exiting right there. See? It's just the edge of the biceps. So what you can see here is a little bit of a sheath around the biceps. What I'm going to do next is take a spinal needle, and then we're going to pass a marker stitch through the rotator cuff. And this allows me to find this area very quickly when we change positions with your shoulder. So you'll see the needle come through. We'll know that's right in the mid portion of the cuff, right there. And then our, hold the camera for me. Our marker stitch is just a purple suture that doesn't stay. It's absorbable, but we don't leave it in. We take it out. We just use it to find this area very quickly. That'll all make sense in a second. So there's that marker stitch coming in. In just a second, you'll see how, Mayo scissors, please. In just a second, you'll see how that stitch goes through the cuff. So see, there it is going through. We're going to go off on the video now and change positions with your shoulder. This is fine. This is the back of the shoulder. We hadn't videoed it, so I just wanted to show you on video. This part looks pretty good. You almost have the look of a shoulder that's built to be a little bit lax, a little bit loose, but I don't see anything that needs any surgery. That looks pretty good otherwise. Okay, so now we're going to change positions with your shoulder. Okay, so we've got the marker stitch. I need a grasper. There's the marker stitch. You can see how red and inflamed the rotator cuff is where that suture is going through it. Go ahead and pull yours. Yeah, And so now as we pull that, we'll get a good look at the cuff in this region. And now we'll take our shaver and we'll take off some of this inflammatory bursal tissue so you can get a good look at the cuff below. We're more towards the front of your shoulder, the anterior portion of the rotator cuff. And we're seeing that Although there's a lot of inflammation, so far I haven't seen a bad tear. There's a marker stitch again. We'll get that one pulled. As you see there. Okay, and so now we'll look at this rotator cuff pretty carefully here. Make sure there's nothing else we have to do. We've already taken off a couple bone spurs just to let you know what we've been doing so far. If this tendon is not significantly torn, that may be all we have to do. But up at the top of the screen here, this bone is the one that we've made nice and flat. It's called the acromion. And so you can see how that's flat. That won't push on this muscle and tendon anymore. And again, we're just working through here. And now I'm going to rotate your shoulder. So it looks to my eye like we've removed much of the inflammatory bursa. Let's put this back in. Blunt for this? This will work. Just want to make sure we've got all our cannulas in. There we go. So as we rotate your arm now, this is internal rotation, which means we're looking at the posterior part of the cuff. And then in external rotation, we can see the anterior part of the cuff. And again, other than the inflammatory reaction in the bursa, I'm not seeing a tear that we need to repair. So this may end up being good news. We just get the bone spurs off that were really bothering you and creating this inflammatory reaction and making you hurt, but we don't have to put you through the full rehab. I do want to shave. Can you come down below and just hold the arm like that? I do want to shave a little bit more here just to make sure we're not missing a tear. So I'll show you a little bit of this. This is all we have to do. We're going to be done in just a few minutes here. So here's the shaver coming in. Okay, slowly rotate back towards me a little bit now. Yeah, so as we see here, that rotator cuff looks pretty good. So we're going to be finishing up here shortly. This will be the end of the video. I'm going to keep doing some things just to get it looking nice and pretty for you, okay? Good luck to you now. Bye-bye.